Good day, everyone. This is a presentation of case study 10 about Mr. Harold and diagnosis and treatment of kleptomania. This is an evidence-based presentation on diagnosis and treatment of kleptomania by Florence Okafor for the University of Texas Rio Grande Valley. Clinical diagnostic for mental and substance use disorder, No. 6261. Lecturer Dr. Geraldo Castillo, August 13, 2022. Brief description of case study 10. Case study 10 presented Harold, a 42 years old married man with two teenage sons. Harold has been working with the same insurance company for the past 15 years. Harold has no criminal records, and him and his wife have very good jobs with no stresses in their lives. Harold was arrested leaving a grocery store with 3 cans of lobster hidden in his pockets. Harold was charged with shoplifting. However, the court asked for a psychiatric evaluation after determining that his records are clean and that he has no need for the food he had stolen. Psychiatric interview of Harold and the symptoms. Harold admitted to the psychiatrist that he has been shoplifting for years. He was just unlucky to be caught this time. Harold described how he enters the store impulsively without any specific purpose. He also described experiencing a growing sense of intense tension to steal once he was in the store. He admitted tension is relieved after the shoplifting, but relief is followed by a strong feeling of guilt. He had reported that he will resolve never to do it again, but will be able to resist the urge for only 2 to 3 weeks before again succumbing to the impulse to shoplift. He reported that him or no one he knows have need for the canned lobsters that he has stolen. He clarified that his choice of a store was apparently random. For reasons that he cannot explain or understand, he most commonly stole canned seafood. The psychiatric interview continues. Harold reports that he has no stress either in his family or work life. He said he cannot explain why he shoplifts and wishes he could control the urge. He admits having a growing sense of futility about his life. He reported that his children were approaching the point where they would soon leave the home, and he all his interests and hobbies have been, resolving around his kids. And with them leaving the house, he has this feeling of an empty life. Harold reports that he occasionally feels that life is not worth living, but he denies any active suicide thoughts or other persistent symptoms of depression or any other psychiatric conditions. His feeling of shame, he reports, is only as related to his shoplifting. He considers himself to be a very hardworking, law-abiding person who contributes to his community by coaching sports. Harold is the only child of an alcoholic father who physically abused his mom. As an adult, he had been a very dutiful and supportive son. He recalled being irritable and quite aggressive as an adolescent. He was often in fights, usually with boys bigger than him, who usually will make derogatory remarks about his size. Generally, his response was considered to be grossly out of proportion to the remark the other kids have made. Diagnosis. To my evidence-based and research, I am coming to the conclusion that the correct diagnosis of the symptoms and etiologies reviewed in the previous slides is impulse control disorder of the kleptomania category. My rationale for making this diagnosis is that Harold meets all four DSM-5 category for kleptomania as described, as I will describe in the next slides. 1. He has failed recurrently for 2 years to control the impulse to shoplift. 2. He described the sense of increasing tension that overwhelms him before the act of shoplifting. 3. He also stated that he experiences a sense of relief moments after he has shoplifted. 4. He clarified that he does not have any reason for the items that he's shoplifting. He doesn't need them. His family doesn't need them. He just have this uncontrollable impulse to steal them. And he denied having any other psychiatric conditions, including depression. So we will see in the next slides what DSM-5 have to say and then compare it to all his symptoms that we have described so far. The DSM-5 criteria for kleptomania must entail the underlisted characteristics. First, recurrent failure to resist impulses to steal objects that are not needed for personal use or for their monetary value. 2. Increasing sense of tension immediately before committing the theft. 3. Pleasure, gratification, or relief at the time of committing the theft. 4. The stealing is not committed to express anger or vengeance and is not in response to a delusion or a hallucination. 5. The stealing is not better explained by conduct disorder, a maniac episode, or antisocial personality disorder. Evidence-based treatment plan. Psychotherapy. Psychotherapy is the preferred first-line treatment that should form a treatment team that must effectively provide a holistic and consistent goal-focused care to patients. These treatment options include cognitive behavioral therapy, aversion therapy, comfort sensitization, systemic desensitization, parent management training, and multi-system therapy. Pharmacology. Per FDA specification, there is no specific cure for kleptomania. Therefore, patients diagnosed with kleptomania should know to exert resources on disease process management and not cure. The use of prescribed mood stabilizers, antidepressants, or atypical neuroleptics should only be restricted to non-amenable aggression situations. Otherwise, psychotherapy is the best treatment. So these medications can also be used to treat kleptomania as advised in non-amenable aggression situations. So the first one here is naltrexone. Is an opioid antagonist that binds at opioid receptors in the brain to help reduce impulsivity, thereby reducing the urge to steal in kleptomania patients. The second class of medications that can be used is the SSRIs. This class of drugs prevents serotonin cell reabsorption, thereby increasing serotonin availability in the brain. This action will help stabilize mood and decrease anxiety or impulsivity as is seen in a kleptomania patient. The third class of medications that can be used is mood stabilizers. Just as their names imply, this class of drugs helps in keeping the kleptomania patient in stable mood that will help decrease the urge to steal. Psychopharmacology. This is a combination of, it's described to be like the best treatment. Like combining cognitive behavioral therapy with some medications, to help manage kleptomania. So some class of medications that can be combined with cognitive behavioral therapy are antidepressants. This may ease the common feelings of shame and self-loathing that accompanies kleptomania. Memantine may be effective in improving the overall symptoms of kleptomania via its mechanism of action on mood, impulsivity, and psychosocial functioning. SNRI, particularly duloxetine, could be used as an effective therapy in combination with dialectical behavioral therapy for patients with kleptomania. In conclusion, this presentation was done to address the appropriate diagnosis of Harold, the case study 10 patient, to state the evidence-based criteria for disease process diagnosis, to state the evidence-based treatment process and procedures with their rationales, and to arm providers and clinicians with varying research-proven procedures or combination of procedures that are effective in the treatment of kleptomania. These are my references, more of my references. Thank you very much for your time and for listening. I hope you learned something from this presentation. Thank you.